Hello and welcome to this month's Better Hearing webinar. Today we are going to be talking about the vestibular system, the other half of the inner ear that we don't always talk about in our audiology world. I am joined by Zachary LaBarth. He is our fourth-year doctoral extern at the UNC Hearing and Communication Center.
Hi, everybody. Nice to see you all. Thanks for being here. We're excited to give this talk today.
To give you some background on our clinic, of course, we're the UNC Hearing and Communication Center. We're located in Chapel Hill, North Carolina. We are a nonprofit since we are part of the School of Medicine, and we are a practice that is built around student training. So we are all faculty members in the Department of Audiology. We work with adults, so we do hearing and vestibular and tinnitus diagnostics. We fit hearing aids and we work with hearing protection. In the hearing aid world, we work with every hearing aid manufacturer, and we run on an unbundled or fee-for-service business model. And as I mentioned, in addition to hearing aids and hearing tests, we also specialize in vestibular and tinnitus testing. We have 3 locations. Our main office is in the picture that you see there on Farrington Road in Chapel Hill. I see patients also at the Seymour Center in more on the north side of Chapel Hill. And Dr. Johnson, one of my colleagues, sees people out at the Orange County Sportsplex in Hillsborough. So for appointments at any of these locations, you can call the number that's on the screen there or send an email to the email you see there. Please take a moment to subscribe to our YouTube channel, maybe not right now, but after this talk. If you go to youtube.com/@UNCHCC, you will find all of my previous webinars from the last 2 years, as well as some other interesting videos. About 5 months ago or so, one of my colleagues did a video on how to treat BPPV with the Epley maneuver, and we have some videos online about that. And we'll be talking more about BPPV in today's talk. So for the first half of today's presentation, Zachary is going to be talking to you. Zachary comes to us in his last year of his doctoral training from Salus University. He received his bachelor's degree in communication sciences and disorders, as well as public health. And, I went too far. He enjoys working with the military population, and he hopes to work with the VA upon completing his doctoral program. He currently enjoys exploring the many hiking trails North Carolina has to offer, and he's looking to relocate back to his home of Philadelphia after he completes his training with us this May. Zachary has been working very closely with our vestibular specialist here at the HCC over this past week, and he has a lot of insight into the world of dizziness and balance. So I'm really excited to have him with me today to give his expertise. So with that, I will pass it over to you.
Thank you so much, Dr. Whitson. And again, it's great for you all to be here. I appreciate you taking the time out of your day to spend about 30 minutes with us, a little bit over, just to talk about balance. And I'm going to work on getting my screen shared here for you. Just give me one moment. All right, and I think we are in business. All right, so just going over our agenda for today, we were going to do a quick anatomy review, going over the ear, specifically focusing on the inner ear, where we'll learn that the balance portion of our ear is located. We'll spend some time talking about the associations between balance and hearing loss, some symptoms and causes of balance disorders. We'll learn how not all balance disorders are the same. And then we'll close up with talking about the vestibular and balance assessment that we do here at the UNC Hearing Communication Center, as well as some treatment options depending on what your balance disorder is caused by. So most of us watching this right now have hearing aids, are living with hearing loss, or might have a loved one with hearing loss. And we as audiologists know that hearing loss and falls risk are very closely associated with one another. In the general population, 1 in 3 adults who are over the age of 65 fall each year. And some studies have shown that that chance of falling can actually increase if that person has an untreated hearing loss. A study from Johns Hopkins in 2012 studied 2,017 participants aging between 40 and 69 years. And what that research was looking at was that even those with a mild untreated hearing loss, that person or individual could be nearly 3 times more likely to fall within a 12-month period. Individuals with untreated hearing loss are more likely to have a history of falling, and we want to look into some of the theories as to why. The first theory is, as I mentioned previously before, and we'll go into more detail, is there's in the inner ear, the cochlear and vestibular portion working together. So if one pathology is affecting one of those systems, it might as well affect the other. Additionally, with hearing loss, there's less awareness of your surroundings. So let's say you're walking down the street and you're not aware that somebody's coming up on the side of you and that startles you, the chances that you can fall are also increased. And then finally, one of the theories is the reduced cognitive resources that are focused more on listening and the difficulties that come along with hearing loss are more related to that as opposed to focusing on overall gait and balance. So those are some of the theories that have been studied and are getting the attention of audiologists and other health professionals around the world. All right, so now I'd like to do a quick anatomy review with you all. I'm sure working with us at our clinic, you've seen this image before, as well as if you've attended our previous webinars. What we're looking at here is a diagram of the ear. When we talk about the ear, we have 3 different sections. We have the outer ear, the middle ear, as well as the inner ear. So thinking about the transfer of sound, sound enters in through the outer ear, travels through our ear canal, vibrates our eardrum, which then sends that sound vibration through the middle ear across these little tiny bones. Sound then enters into the inner ear, stimulates hair cells in a structure that we call the cochlea, and then that sends the signal up the auditory nerve and into the brain. And focusing here on the inner ear is what we want to talk about today, because that's where the balance portion of the ear comes into play. So, as I mentioned, the inner ear is responsible for both hearing and balance function. And hearing loss, specifically sensory neural hearing loss, indicates that there's a problem with the hearing organ or the cochlea. However, a problem with the inner ear may also involve the balance organs, which you see here. We call those the semicircular canals. And that can affect our balance. Your ears work together with other systems in your body, such as your eyes and your brain, to help you understand your place in space. A steady sense of balance includes understanding where you are in space, how to stay upright, and how to keep yourself from falling after quick or sudden movements. Many of those who have trouble with their balance find that the problem lies with the ears. Balance disorders related to the ear can make you feel unsteady, wobbly, or even make you feel like you're constantly moving. These sensations that we sometimes call vertigo can impact your ability to walk, stand upright, move your head, or even sit up. Today we're going to talk about a term called vestibular, and I want to just make sure everybody knows that when they hear the word vestibular, they know that we're talking about balance. So I want to make sure that when those 2 terms are used, they're interchangeable so that nobody gets confused. As we discussed, the inner ear is home to the cochlea and the main parts of the vestibular system that provide information about balance, motion, and location in your surroundings. Looking at these canals here, each canal serves a different purpose and tells the brain different information about where we are in space. The first canal you see senses how we are move up and down in space. The second canal talks about how we move from side to side. And then the third canal discusses how tilting movements are transferred to the brain. Each canal has fluid on the inside, which moves when your head or your body moves. When that fluid moves, it stimulates the hair cells, then it sends messages up to your brain. A common disorder that many of us might have heard of is BPPV, or benign paroxysmal positional vertigo, and that's when those small crystals that are located here in the utricle become dislodged. And when they become dislodged, they can fall into these canals, causing that fluid to move, which then tells our brain and makes us think that we're moving when we're actually not. So a common way that's described is, I turned my head in bed and all of a sudden I started to feel dizzy. So that's something we're going to talk a little bit about today, but I wanted to just touch upon that while we have this really good image here in front of us. All right, so difficulties with balance are not always related to the vestibular system. It's a multifactorial system, and there are several components that help us stay balanced. So what we're looking at here is something we call the balance stool. And when we think about balance, there's three main components that play vital roles in helping our brain control where we are and how we stay balanced. The first is vision, so we use our eyes to maintain our balance. Our eyes, we like to call them our third balance organ, because it's not just the ears, it's also what the eyes are seeing and the information that the eyes are sending to the brain. Second is proprioception, so what's our feet on the ground telling our brain as we're moving? What are the other parts of our body, our hands, our arms, all of our body parts? What do they tell our brain where we are in space and how we're moving? And then finally is that third part, which is the ear, the inner ear, the vestibular system. All three of these parts talk to each other and talk to the brain and help us determine how to stay balanced. If we lose any one of these parts, the brain now is missing a link to help us stay balanced, which can cause imbalance and cause us to possibly fall or feel dizzy or experience that symptom of vertigo that can sometimes be described when you come see your audiologist. An important part of the brain, which I mentioned down here below, is the cerebellum, and that is what really controls all of these parts, and it helps regulate the information that all the parts are feeding into the brain. So what is a balance disorder? And the simplest way that we can put that is it's any condition that makes you feel unsteady or dizzy. Dizziness is an umbrella term, and it can be described in many different ways. So, symptoms of dizziness can vary from person to person, and it's not always caused by the same thing. Some of the most common symptoms include vertigo, or that feeling of spinning, lightheadedness, motion sickness, feeling unsteady or like you're constantly off balance after quick, brief movements, the feeling of feeling foggy-headed, or kind of like there's something inside your head that you're not sure why it's making you feel off. And then also the feeling of feeling faint. So all those things can be considered when somebody describes that they're feeling dizzy. If you come in for an evaluation, you may describe your symptoms in a certain way, and our job as audiologists is to ask those really important follow-up questions to try and pinpoint exactly what's causing your dizziness and what your symptoms mean. Some of the other common symptoms are headaches, migraine, nausea, vision problems, or disorientation. Some of the studies that we looked at when preparing for this presentation, we also learned that some of the less common symptoms include vomiting, anxiety, fear, or a change in heart rhythm. All right, let's talk a little bit about the causes of balance disorders. So when an audiologist does vestibular testing, we're looking at what the causes are, and some of the most common disorders that we see when we do that balance testing is, again, the BPPV, which is short for the benign paroxysmal positional vertigo, Meniere's disease, a vestibular schwannoma, could be a virus or a bacterial infection of the vestibular system, or it could be an autoimmune disease. While the term dizziness and vertigo are commonly interchanged to describe patients' symptoms, not all dizziness or vertigo is due to the ear, and some dizziness can be caused by other factors, including an injury to the ear, an injury to the brain, also called a TBI or traumatic brain injury, cardiovascular or circulation problems. If we're having problems with blood flow, whether that be to the heart or the brain, that can cause dizziness as well. Certain medications which regulate our heart, our lungs, other parts of our body, that can also play a role in some dizziness. As well as another key one I want to talk about is peripheral neuropathy. That's when we lose that feeling in our feet or our hands, which is what keeps us balanced and keeps us, upright on the ground. If you're diagnosed with that, that can also cause some difficulties with balance. All right, so we talked about some of the causes of balance disorders, and some of those are curable and some are managed rather than cured. For those that are chronic, sometimes dizzy symptoms can be triggered by certain factors. But there's a difference between a trigger and a cause. Triggers are stimuli that can aggravate or awaken vestibular systems. However, triggers do not cause the vestibular disorder, rather it just stimulates those symptoms that you're feeling. If you can control the triggers, you might also help you better manage those symptoms. Triggers vary significantly from person to person or illness to illness, so each person's treatment plan will be unique to them and what they specifically need. To use an example of what a trigger can be when it comes to balance, if somebody is moving their head, as we mentioned earlier, those crystals that can move around in the semicircular canals, if you move your head and it causes those crystals to move and stimulate that fluid, that's going to trigger your dizziness. However, the cause of your dizziness is because there's something going on within the vestibular organ. So I'm now going to switch over to Dr. Whitson, who's going to discuss the assessment and treatment of balance disorders. Thank you, Dr. Whitson.
Thank you, Zach. So when you're being assessed for balance problems, there is usually a team of people involved. Because it's a multi-systematic problem, we need different specialties involved. So that will almost always involve your primary care physician, of course. An ENT will almost always be involved as well. And if they're not involved yet, I highly recommend getting established with an ENT because they are the people that are going to not only be aware of the benefits of physical therapy that could be good for your balance, but also medications or surgeries if needed. So the ENT serves as a ringleader in what tests are ordered and what referrals are made. And so that person, depending on what they need for their care, may also see physical therapy, will more than likely see physical therapy. They may see audiology if we think the ear may be related to their balance concerns. They may see an ophthalmologist, neurology, radiology, or psychology if needed. So some of the tests that may be ordered on top of having a very thorough case history and understanding of the symptoms may also include a hearing exam, clinical tests of balance, which we'll talk more about what some examples are later on, posturography that looks at an objective measurement of someone's stability, a vision exam, blood tests, or perhaps imaging of the head and brain. So when should you be referred to audiology for a vestibular assessment? If you're having any episodes of unexplained dizziness or vertigo, and vertigo specifically is this spinning or motion sensation even when you're still. So if you've got some dizzy symptoms that you know are related to your blood pressure medication, your primary care physician should be in the know about that, but that doesn't typically result in a referral to audiology. But if you're having these episodes of vertigo that are not otherwise explained, it could be related to a problem with the vestibular system. And on top of that, if you're having any ear-related symptoms that started at the same time as any kind of dizziness, so that would be hearing loss, tinnitus, or any ringing, buzzing, roaring sounds in the ears, pain in the ear, or a feeling of pressure or fullness in the ear, especially if you're only getting those symptoms in one ear. And that may be a sign that something is wrong with just one side. A vestibular assessment by an audiologist that specializes in balance will help assist the ear, nose, and throat physician with their differential diagnosis. Physical therapists can also specialize in vestibular assessment and treatment. And so we will often see physical therapists doing this testing as well. So what either the audiologist or the physical therapist is looking at is, can the ear be ruled out as a contributing factor to the dizziness? If the vestibular system is involved, is it the peripheral ear? Or in other words, is it the inner ear itself? Or is it something more central in the brain, perhaps related to a problem in the cerebellum? The audiologist is also looking out for signs that this patient may need additional evaluation by a neurologist. And the audiologist and physical therapist will conduct a falls risk assessment. So I kind of mentioned this peripheral versus central vestibular dysfunction, and I wanted to just tease this out a little bit for you. So with a peripheral vestibular dysfunction, that means there's a problem with the ear itself, the vestibular system in the inner ear. This can affect people of all ages. It's usually a sudden onset. So you were fine until one day you started having these episodes of dizziness. It's typically intermittent, so it comes and goes with pretty severe symptoms. So you know it's there. And it may keep you from going to work because you feel really off, or it could be so bad you can't even get up off the floor. It can be affected by your head position or positioning of the body. Typically, with a peripheral problem, our fine motor function and our general coordination will remain intact, and certainly between episodes, we see that. And you may also likely have some hearing loss or tinnitus in one or both ears. With a central vestibular dysfunction, this can affect all ages, but it's more commonly seen in older adults. And it's usually a gradual onset because it's something that's going on in the brain, though it could be sudden onset as well. It's typically unaffected by positioning of the head or body. And our fine motor function and coordination is very often affected by a central problem. And this could happen potentially after a traumatic brain injury or concussion. And we also see some central vestibular dysfunction after a stroke or with certain central nervous system disorders. It's not very common to have both peripheral and central vestibular dysfunction, but it does happen sometimes. And this person is at a much higher risk for a fall. So an example of having both a peripheral and central vestibular dysfunction, this may happen after someone has a traumatic brain injury, where there's been an injury to the brain, as well as the peripheral semicircular canals on one side of the head. So you may have BPPV, where that blow to the head caused those crystals to be knocked loose, and you're getting vertigo from the movement in the semicircular canals. That's not supposed to actually be happening. But you may also now have a problem with how the cerebellum is controlling these different systems and maintaining your balance. And so these are some of the things that the audiologist and the ear, nose, and throat physician is trying to tease out with the testing that we do. So if you come in for an vestibular assessment in our clinic, we're going to do a hearing test if you haven't had one recently, because hearing loss is so closely related to vestibular dysfunction. We need to know the status of your hearing to have a full picture of the health of your inner ear. We'll also do some bedside and physical performance testing. So this gives us an idea of your overall balance. With V&G, or video nystagmography, we're actually looking at how the eyes respond to different tests that we do. The eyes are kind of our gateway into the ears, because our ears, when we turn our head, they're sensing this movement, and it's almost like they have reins on our eyes, and they're pulling it in different ways to help us maintain our balance and our state of not being dizzy and nauseous. So the V&G is looking at our eye movements to check for irregularities, either with vision, or maybe we take out all the light, and so you have vision denied, and we're looking at how your eyes are reacting to different tests. And so with the repositioning testing, we're looking at how different head and body movements may or may not trigger your dizziness. Caloric testing is what you see being done in the picture on the screen, and that is looking at how your symptoms are triggered if we put hot, or, well, it's warm or cool air in the ear canals. So when we change the temperature of the ear canal, that temperature change reaches the inner ears. And since our vestibular system is filled with fluid, and we know from the laws of physics, when there's a temperature difference, fluid starts moving. And so we're checking to see if the fluid's moving and someone gets dizzy. That tells us, all right, your vestibular system is working. It's sensing this motion. And if that person doesn't get dizzy, it tells us there may be some kind of weakness in this ear. So you've had your testing all done, you've been assessed, you have a diagnosis, and now you need some treatment. And depending on the cause of the balance disorder, that will direct us towards one treatment or another. So BPPV is by far the most common cause of vertigo, certainly for people of middle age. And that is treated by Epley maneuvers. And this is something that a lot of people have heard of. They take you through different head turn movements, basically with the goal of getting those crystals back to where they belong. BPPV is the only type of dizziness that an audiologist is able to treat. If you have any other form of vestibular dysfunction, your treatment is going to be done by a physical therapist. And so that may be a form of vestibular retraining therapy with different types of exercises to try to strengthen the connection between your ears and how the brain interprets the information. Your ENT may also recommend diet or lifestyle changes to try to avoid some triggers. They may recommend medications or surgery if that is indicated. So this is a diagram of what the Epley maneuver might look like when we're treating BPPV. Again, the goal is really purposeful, slow head turns to get those crystals or otoconia back where they belong. A question I get a lot in the clinic, whether it's from a patient themselves or maybe they have a parent who's older who has some balance dysfunction and hearing loss, is will these hearing aids help improve my balance? Well, the answer is kind of, right? So the hearing aids are not curing any type of vestibular disorder. They're not going to fix a problem in the cerebellum. But what hearing aids can do is improve our spatial awareness. So we're more aware of our surroundings, and if someone comes up on us suddenly from one side, we can hear them approaching and we're not startled, or dogs running past us. Maybe we're less likely to trip over it if we can hear it coming. Zach also mentioned at the very beginning of this talk that when we live with hearing loss, we're using a lot of our cognitive resources just to listen and to process. And as we get older, that is a really difficult thing to do. Our auditory processing slows down. The brain only has so many resources available at any given moment. And it actually takes a lot for us to maintain our balance and walk down the street. And if you add on an uneven sidewalk to that, it gets even harder, or poor lighting. So we need a lot of cognitive resources to stay upright and to not fall down. But what if a lot of those resources are taken away from our balance and used instead for just hearing? That makes it really difficult. So hearing aids can help free up some of those resources. So here are some resources for more information. If you're having any dizzy symptoms at all, you should, of course, first tell your primary care physician. If it's not something that looks medication related, they will likely refer you to an ear, nose, and throat physician. If you're one of our patients and you see us, we're happy to talk to you about your dizzy symptoms and can give you some guidance on what to do next. Here at the Hearing and Communication Center, our vestibular specialist is Dr. Devin Wiest, and she started with us a number of months ago now, and she is a really fabulous resource to our clinic. The CDC's website and VITA, which serves as a support group for people with vestibular dysfunction, also has really great resources for people who have vestibular dysfunction. So to summarize what we've talked about today, dizziness and imbalance is multifactorial. So a proper balance assessment is going to include a team of interprofessional providers. People with untreated hearing loss are at an increased risk for a fall. And it's not very well known that audiologists are specialized in both the assessment of hearing and balance, though not every audiologist is a balance specialist per se, but we are all trained on it in our graduate program. A vestibular evaluation can determine if the inner ear is contributing to your dizziness or imbalance symptoms. And while hearing aids don't cure the underlying cause of dizziness, they can help improve our overall spatial awareness and can free up cognitive resources to improve our gait and stability. So if you have hearing aids, wear them, not just for communication, but for overall health. So at this point, we will break for questions. If you'll type them in the chat box, we'll answer them on here. And I am going to end our recording for our YouTube viewers, and we'll stay on to answer questions for our live audience.